Thank you very much. Good morning, everyone. Thank you, PIDS, for inviting me to be a discussant. Good morning, Dr. Abrigo, and I will be commenting on the study of his team. But good morning also, Dr. Irene and Dr. Belleza. I think just as a preamble, thank you, PIDS, for inviting two psychologists to be discussants in the work of two economists. I think that's a very good show of future interdisciplinarity in development work. I should mention that my discussion this morning also draws a bit, well, no, quite a lot from my work with the EdCom 2, where I was the focal person reviewing the Anti-Bullying Act's implementation. So I will draw from that work that I did when I was still with the EdCom 2. But I do have a few points to focus on, and I will go fast in the interest of time. The first two are really methodological questions for Dr. Abrigo and other researchers. This one is more specific, Dr. Abrigo, that when you model community variables in your analysis, I was not sure what the ways by which you controlled for this are, the way you estimated the community level variables. And my question is coming from the fact that the PISA sampling was only randomized at the level of the region, no? So PISA randomly selected schools, and then when the schools were randomly, well, after they were selected, they would randomly choose students within the schools. So there was no random selection within the region, or rather below the region level. So there was no randomization at the provincial level nor the municipal level. So in a sense, I do worry about making inferences about provincial and community level parameters, given that these were not randomly sampled at that level. So it will probably be very noisy if you think about it. But that's something you can consider in your analysis. Dr. Belleza already raised my second point, which is the meaning of bullying. It was very interesting that in the study reported by Dr. Herin's group, hurt was a very important concept in the definition of what they were mentioning. In Dr. Abrigo's study, which referred to the PISA, I should underscore that they did not use the word bullying at all. As Dr. Abrigo mentioned, they asked the participants how often this happened in the past week or so. And that these were behaviors that could be possibly interpreted as bullying, but also not. So for example, one of the items mentioned was made fun of me. Okay. Dr. Belleza mentioned that classic definitions of bullying involve intention. No? Now, I also refer to another database that involves bullying. This is a WHO's global school based survey of health of students, student health rather. And in their survey, they use the word bullying more explicitly. So I think the different prevalence rates can be explained by the degree to which bullying was explicitly referred to. And I do think that the PISA data may be overestimating actual bullying, given that some of the indicators may be not considered bullying by other researchers. Now, this has implications for the definitional issues, has implications for policy. For example, one of the last things we did in the EdCom was to review the IRR of the Anti-Bullying Act, and mindful of the importance of intention in how bullying is defined, we discussed whether the intention should be part of the Anti-Bullying Act definition of bullying, but the lawyers in the group were very clear we cannot prove intention, and so they preferred that the intent be excluded from the definition of bullying in the Anti-Bullying Act's IRR. So we do have, the Dr. Belleza, the definition is not simply a methodological issue, it has policy implications as well. Now, but to the main findings of Dr. Abrigo, I agree that school bullying is concerning. It's not a it's not only a viral phenomenon that will be forgotten after a few weeks. And I like how the results of Dr. Herin and Dr. Abrigo's study both underscore how this is associated with lower achievement by and large and other negative school-related processes. I do worry about the inference about economic losses later on, but I'll go back to that later, no? Um, the concern I raise is a matter of causal inference. No? Dr. Hirin's data, I think, allow us to have a better sense of the causal chain of bullying experiences and academic outcomes. But the PISA data is cross-sectional, so it's very difficult to make inferences about the causal link. And I do worry that about making causal attributions between the experience of bullying and achievement. It is plausible in a theoretical sense that this elasticity or correlation between bullying and academic outcomes may actually be artifacts of the school environment or the community environment that do not support academic proficiency. So I'm going to conjecture here, and this is a thought that I have been trying to polish over the past few months. The idea is that bullying is not necessarily the cause, not even a distal cause of poor achievement, but the experience of bullying is my assertion or a possibility is that it is more likely to happen in school environments where bullying is normalized. And what are these environments where bullying is normalized? This is an environment that also does not emphasize high achievement, does not emphasize rigor, discipline, whether it is academic or behavioral. There are some analyses, this came from the DLSU EdCom studies, that looked at school level predictors of bullying. And the cluster of schools that have the highest levels of bullying are also the schools where the students were less likely to reject bullying uh, um, as a problematic behavior. Now, let me clarify that. There is also data from the PISA that Philippines is lower than the global norm in terms of the rejection of bullying. So compared to the global norm, Filipino 15-year-olds were less likely to reject bullying as problematic. And in the previous studies I referred to, uh, in the schools where the rejection where unlike the rejection of bullying is least likely, that's where bullying happens more. No, so let me put that there, and we can discuss it later on. No, now I like the optimism of Dr. Abrigo that bullying is a modifiable risk factor, but see that optimism is premised on the assumption that bullying is a predictor. But what if bullying is actually an outcome that is enmeshed by these environmental factors that produce both bullying and lower academic outcomes? No? What if bullying is actually an artifact of a host of other social environmental factors that also lead to learning losses? If this is the case, then we do have to worry about the applicability of successful international programs and look at the conditionalities of this. Having said that, I don't want to be too cynical. In our work in EdCom, we did find out that there were successful anti-bullying programs in schools and communities. Later on, if there's more time, I can speak to this, but we have to look into the conditionalities of successful anti-bullying programs. And this was a point underscored by Dr. Abrigo as well. Moving forward, I think I echo the point that the results of the study do tell us what to watch out for, and the depth eds approach can benefit from this. Unfortunately, however, it does not look like the Anti-Bullying Act will be a very viable policy instrument for this. It's a good concept. In the past 10 years, it was really focused more on handling of complaints and cases, less on prevention. And I can speak more to this later on, but because I have limited time, maybe if after all this, if you are interested in the implementation related issues, I can speak to that. No, but same. This goes to the same point of capacitating school personnel. Um, when we did field work on this with the EdCom, basically there was very little in terms of capacity building. The National Educators Academy of the Philippines capacity building was really focusing on orienting personnel on DepEd memos related to child protection, child-friendly schools, rights-based education, etc. And they are concerned that the offices were concerned that they do not have experts in anti-bullying programs from the central office down to the division. So the successful capacity building efforts were those done in progressive local government communities and with the help of some NGOs and private sector. Um, in a way, I would like to conclude by inviting everyone to kind of temper our conclusions and expectations. No, I think it was very the point of Dr. Abrigo regarding the role of the principal and counselor uh, being potentially important is where we kind of the data hit reality very differently. As he said, the data do not seem to show that the principals and the counselors make a difference. But the literature would say it's not a matter of having a principal or a counselor there. And there might be data issues here also, Dr. Abrigo, but because when we look at the PISA data, which is different from the DepEd data, many of the students actually reported, and many of the school heads also reported, no counselor. But for me, it's not just the presence or absence of these personnel; it's what they're doing. And as you said, what do they know about bullying? How do they try to develop anti-bullying programs? Specifically, because the IRR of the Anti-Bullying Act requires contextualized school-based anti-bullying policies. Okay. Um, and this is where I think things need to be fleshed out, and I'm not too optimistic about whether the policy instrument is capable of enabling the work that is needed at the school level. Again, another matter where I feel like we have to temper our conclusions is with inferences regarding its effect on the economy. I think Dr. Abrigo, the measures of bullying in PISA need to be considered before we point to the how much weight we give to the contributions to the GDP, even if it was actually very tiny, as you know. No? One final note in my case is that the whole session this morning and Dr. Abrigo's presentation as well highlighted how bullying is related to mental health, and that is the premises for this concern. But actually, I should underscore that the PISA data do not provide very good evidence for the relationship between bullying and mental health. I think Dr. Hirin's longitudinal data may have better evidence, and maybe the data from the WHO's GSHS may be a better source for that. But in conclusion, I think this is a curious conclusion because if the evidence for the relationship between bullying and mental health is not there, it may be because of several scenarios. No, it could be that the relationship with mental health is not simple linear that is picked up by our standard regression methodologies. It may be that the effect of bullying on mental health is when it is very extreme. So it may be you have to reach a certain point before it affects it. We did find, as Dr. Belleza mentioned, that people respond to bullying in many different ways. And in our field work in the EdCom, we saw that when we talk to kids, they say, oh, we experience this all the time. And when you ask them, how does it affect you? We just deal with it. No? So in a way, for many children, this we talked about primary school and secondary schools, they do acknowledge that this is experience, but for them, this is something, this part of what they have to deal with in the school environment that is already very stressful. And to some extent, you get a sense that it's being normalized in their experience. It's just one of those things in the lives of many school children. Now, that's a very problematic conclusion if you think about it. if the kids themselves seem to be normalizing these bullying experiences, that may be one reason why the relationship with mental health is not very direct. But from the point of view of a social psychologist, that may even be the bigger problem. The bigger problem may be that our students are looking at bullying as a normal part of their social experiences in our schools. Thank you very much again for letting me comment, and looking forward to continuing discussions with everyone. Thank you.